Our next guest, again, needs no introduction. One of my favorites, Dr. Jason Emer.
How
Hi.
are you? Love seeing you.
How are you? I think we're
How is
matching.
everything? I
Oh
did
my
it for
gosh.
you today.
Did you?
Blue. I
Oh.
knew we would be perfect with blue.
Yes, so what's new? I mean, I don't know if you even got a chance to even rest during this entire
No,
show. I
haven't
think
yet.
it's like, it could be like the Dr. Emer show.
Well, that could be fun, I guess, right? At some point. But the thing is, there's so much going on lately in this field, and I just don't want to stop, so I might as well educate while I'm young and have the energy.
And you are young. We figured out our age difference, guys.
Yes. We're about only a month apart.
We're 10 years apart.
I know, it's unbelievable. Can you
It's,
believe that?
Yes, but
So I
Jason
gotta
and
do
was-
PRP,
Yeah.
I gotta do
You have to come
needling
down,
treatments, I gotta
right?
come, we're gonna treat each other
Exactly.
from now forward, that's our goal.
This is one of the best things about the aesthetic show as well, is that, you know, you find the colleagues, because you can't treat yourself. Like,
You
I
shouldn't.
cannot inject myself, and you're like, I haven't had treatments because you're so busy, so hey,
I know.
why not?
I
So
agree.
what are you most excited about? What are you doing in your practice? And I follow you on Instagram, obviously, so does everybody. And so what are you most excited about?
I think the past couple years has been combination therapies. You know, you coined that years before.
Yes.
Doing a combination of things to get a better result. Treating acne scars, treating pigmentation have become really popular over these past years, and doing facial sculpting with fillers. Rather than filling a line, we're creating definition,
Yes.
we're tightening, we're giving, we're not just treating a fold, we're giving jaw lines
Right,
and chins.
Yep, you know, recreating the structural support
Yes.
for the
Anatomical.
skin, correct.
So that I love because it makes us more artistic,
I
and
love
it makes
it.
technique and expertise so important when it comes to these treatments.
We're not injectors, we're artists.
Exactly, and that's what
it.
you're paying for. Not paying for the syringe, you're paying for the person behind the syringe.
Correct. And you
So-
can tell, this guy's an artist.
So that's where it comes to me with doing the lipo,
Yes.
because the lipo's progressed now to being not just fat removal, skin tightening, contouring, muscle defining, fixing bad work, sculpting the body, lifting the buttock, breasts. You know, we're doing everything now from, female implants to male implants like chest implants and arms and calves. So it's total head to toe rejuvenation.
That's it, head to toe. And I know that people ask you this because the before and after photos that you show on your Instagram mostly are male body, sculpting, but you work on women too, right?
I know, and the problem is I showed examples today. A lot of women come into me and say, why don't I see a lot of women? The women end up not wanting me to show
I
that
totally
they had the
get
work
that.
done. It's unbelievable.
Women
but the men,
want everyone to think that it's just all natural. I'm born
I
with
know.
this. I woke up like this.
I'm easing them into the facials and the peels, and at least posting that so people know that they're coming to my office.
Right.
But these, high def males, and they have abs underneath, you can really make a striking improvement. With women, with looser skin and with contouring, you can make a big improvement too. So it'd be really great to be able to see,
absolutely.
these new technologies like Renuvion and BodyTite have really transformed how we do lipo. I mean, you do a lot of fat reduction.
Absolutely, and I love the Renuvion technology. So
See?
yeah.
So it's all about those combinations, and then I think the future is both internal and external wellness, and that's where I'm really going with my practice. We have our plastic surgeons, our hormonal optimization physician, personal trainers, nutritionists, along with the dermatologist, the skincare specialist, and the estheticians. So it's literally doing everything to get that person to look and feel good.
I love that, and I've always kind of talked about holistic way to treat a patient.
Yeah, I agree.
We offer yoga classes in our practice. We talk about nutrition because
See?
as dermatologists too, right?
Yeah.
We know that our skin's appearance is a reflection of how healthy we are.
Very.
Our psychological even status,
very.
and so that's all really important.
Yeah, I mean, hair loss, pigmentation,
Correct.
acne, all has a role with hormones and stress and nutrients. Patients who undergo chemo, they lose a lot of facial volume. You lose a family member, the stress causes a big
Yes.
impact on your skin. So treating those patients that way with optimization, nutrition, plus the lasers, plus the long-term treatment plan is what really is driving my practice right now, and it's making me excited because there are many devices, but you don't need all the devices to really get the patients the results they're looking for.
Did I hear that right, Jason?
Don't listen to me when it comes to the companies, don't listen. No, I mean, listen, I like doing the
I agree
research,
with
you
you.
know, I like doing the
Yes.
research, I like being up to date, but if someone said to me, you know, one or two would be hard to pick, but you don't need necessarily 10, 20, 30
Agree.
lasers to get a great outcome
Correct.
for what patients are looking for. And even now, I'm finding that for pigmentation, I'm going more towards peels and topical therapies now, especially with these stem cell products, and really good antioxidants and combination products. We're getting so much improvement in the glow of the skin, in pigment and in color,
Yes.
you know, and it's really
And-
transforming.
And I think as dermatologists, we really need to be pioneers in that.
100%.
You know, I have to educate my patients sometimes if they have wrinkles like around the mouth or their cheeks, and they want me to keep fill. I'm like, no, there's a point
Right.
where we need to not use fillers. We need to work on the skin.
Right, and that's where I always tell people there's those areas of aging. You know, you have your volume loss, your laxity of your skin, your texture, your color, your movement lines, and then surgery, whether or not we're treating, you know, the face or the body. You have to address each of those areas with appropriate treatments.
Correct.
Someone keeps coming in for lines, but they're doing filler and they need a laser. It's not gonna look natural.
Right, and
so
that's it.
going to a good doctor that understands those areas and kind of fine tunes it. The other thing I think as dermatologists, we can really fine tune the combinations of, you know, using the PRP and the skincare, doing the peels and the lasers, combining all these things with surgery give even better outcomes. There's so many surgeons that I know who do facelifts and don't do a laser at the same time,
Right.
don't do a skin tightening
Or
at the same time.
Don't add volume with fat or...
Right, exactly,
Yes,
or
doesn't make any
revolumize with
sense.
stem cell facials and fat, and the results aren't as good. And having that combination is what's really giving these natural looking results. There was a physician yesterday talking about how if you overfill the face with gels, then your face looks translucent
hard.
and full long term,
and
like
it doesn't
have the
move.
natural features.
Right,
Exactly.
doesn't move as well. So,
So less-
that's why I love fat tips.
Yeah, less fillers, going to more natural alternatives
Correct.
like fat and
working
Sculptra
on the
Bellafill for
skin.
building collagen, working on the skin, and combining these skin tightening treatments earlier on to get a tightening and contouring and preventing a lift. Or if you do an early lift, using those treatments to prevent or keep that lift and prevent the future aging.
Right, and so I know people want to know, I can't let you go without you giving us your biggest tip on how to blow up in social media, because you know,
Yes.
Dr. Emer
Well,
is
So you
expert.
here's the key to going viral. That's what I always tell people. You take a treatment that everybody does and you just do it in a different area. So for
What?
example,
Okay.
we post the booty facial the other day. It has 100,000 views in a day.
Uh-huh.
It's a regular facial being done on the booty. You know, and yes, everyone wants that, but it's shown in a different way. You know, or let's say you're doing Botox on the face, but now let's show it for sweating or for migraines, or for the other day I did it for redness under the breast. Show it for something different, you know, Scrotox, for example.
Yeah,
It's a hit, you know, maybe
It
not on
was.
social
I think
media.
that's what, wasn't
but-
that one of the things that
Yes, that's
really
one of
made
those things that
Dr.
made us
Emer-
successful.
Yeah.
So with that said, you know, you also being yourself in a unique way.
Agree.
You know?
I think being authentic in social media will allow you the longevity as well. And
Yeah.
then nowadays, people can really tell whether that's really you. They
Yes.
want to know you as who you are.
Right, they
and-
want to know you before they come in. There's so
Correct.
many times people give me a hug or a kiss the second. I know that happens to you the second you walk in the room because they've watched all your videos, they've seen all your pictures, they're already super searchers, they're so smart when it comes to it. And I
Really
also
true.
think, you know, you don't need to reinvent the social media, you just need to be educational and really put forward the brand that you want. So, you know, I show, sometimes me every Friday night, I show me working out. It always
Yes.
goes viral.
You guys want to see guns, you have to
Yeah.
follow Dr. Emer.
Well, thank you. But it always goes viral because the people following me, they want to be
wanna
healthy
they're being
inside and out.
inspired
And they're
by you.
inspired by the fact that we're a
Yes.
heart surgeon that's working hard
Yes.
and you know treating people during the day, but working out in our after time at night.
Mm-hmm.
And so it's really showing people the true type of person you are. That's what goes viral.
That's awesome. Well,
know,
Jason.
I love you, Tess.
I love
you.
too.